The elderly woman's voice cracked like autumn leaves when she whispered through the apartment door. "Are you the one who's been taking care of my mail?" Sarah Chen froze, key halfway to the lock of 4B, her neighbor's mailbox overflowing with unopened envelopes for the third week straight. She'd been quietly sorting through the mess, paying what looked urgent, discarding the junk, never expecting to get caught. Now Mrs. Kowalski stood in her doorway, oxygen tank humming beside her, eyes sharp despite the frailty. "I saw you," the old woman continued, "but I needed to be sure you weren't just another vulture circling." Sarah's throat went dry. She'd moved into the Riverside Apartments 6 months ago, after her startup collapsed and took her savings with it. The building attracted people who needed cheap rent and fewer questions. She'd noticed Mrs. Kowalski's mail piling up, then the smell, then the silence that felt too heavy. "I wasn't stealing," Sarah managed. "I was just trying to help." The woman's laugh was bitter. "Help? Right. You have any idea what kind of help I actually need?" She paused, studying Sarah's face with the intensity of someone who'd learned not to trust easily. "Check on my heart, too, if you're so concerned. Because these pills they keep sending, they're not working, and the doctors won't listen to a woman my age who can't afford to be wrong. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow I've saved something extra special for you." Sarah had spent the last 8 months rebuilding her life from the ground up. The tech company she'd co-founded with her college roommate had imploded spectacularly, leaving her with debt, a shattered reputation, and trust issues that ran deeper than she cared to admit. The Riverside Apartments weren't exactly the penthouse she'd once imagined, but the rent was manageable on her freelance income, and the neighbors mostly kept to themselves. Mostly. Mrs. Kowalski had been the exception from day one. The woman lived directly across the hall in 4A, and Sarah had noticed her immediately. Not because of noise or complaints, but because of the opposite. The kind of silence that made you wonder if someone was still breathing on the other side of the wall. Sarah had a routine. Coffee at sunrise, emails until 10, then a walk to clear her head before diving into client work. The mail delivery happened around 11, and she'd started timing her trips to coincide with it, partly out of curiosity, and partly because she'd grown up in a house where her grandmother had taught her to notice when neighbors needed help. The first time she'd seen Mrs. Kowalski's mail overflowing, she'd assumed the woman was traveling. By the second week, she'd started to worry. By the third, she'd made a decision that would change both their lives. Sarah had grown up watching her grandmother navigate the medical system as a woman in her 70s, fighting for proper care while dealing with doctors who seemed to think age automatically meant exaggeration. When Mrs. Kowalski mentioned her heart medication wasn't working, something cold settled in Sarah's stomach. "What do you mean they won't listen?" Sarah asked, still holding the key to the mailbox. Mrs. Kowalski shuffled back into her apartment, leaving the door open in what Sarah took as an invitation. The space was immaculate but felt hollow, like a museum of someone's life rather than a home where living happened. Pill bottles lined the kitchen counter in neat rows, each labeled with times and dosages in handwriting that grew shakier toward the recent dates. "I mean," Mrs. Kowalski said, settling into a worn armchair with the careful movements of someone whose body had become unreliable. "I tell them the chest pain is getting worse, the shortness of breath, the dizzy spells that come out of nowhere. They check my chart, see I'm 81, and assume I'm being dramatic. They adjust the dosage and send me home with a pat on the head and instructions to rest more." She gestured toward the pill bottles. "I've been resting for 3 weeks. Nearly died on Tuesday because I was too weak to get to the bathroom." Sarah perched on the edge of the couch, her mind already racing through possibilities. "Have you tried getting a second opinion, or bringing someone with you to appointments?" Mrs. Kowalski's laugh was sharp. "With what money? And who exactly would I bring? My daughter lives in Portland and thinks I'm being hysterical. My son calls twice a year when guilt overwhelms him. The neighbors here barely know my name." She studied Sarah with those keen eyes. "Except you, apparently. You're the girl who's been paying my electric bill." Heat crept up Sarah's neck. "I wasn't trying to overstep. I just noticed the disconnect notice. And I thought maybe you'd missed it while you were sick." The truth was more complicated. Sarah had been exactly where Mrs. Kowalski was now, just in a different way. When her company failed, she'd spent weeks paralyzed by the overwhelming pile of legal documents, bills, and correspondence that needed immediate attention. The difference was she'd been 28 with a support system. Mrs. Kowalski was 81 and apparently facing it alone. Overstep, Mrs. Kowalski repeated, as if testing the word. When was the last time someone overstepped in a good way around here? She reached for a thick manila folder on the side table, movements deliberate despite the tremor in her hands. You want to really overstep? Help me figure out why 3 different doctors are giving me conflicting information about my heart condition, and why my insurance keeps denying tests that might actually tell us what's wrong. Sarah opened the folder and immediately understood why Mrs. Kowalski felt lost. Medical records, insurance forms, appointment summaries, and billing statements created a paper mountain that would challenge someone half her age with perfect health. The handwriting was difficult to decipher, the medical terminology dense, and the timelines scattered across multiple providers who apparently didn't communicate with each other. This is a mess, Sarah said, then caught herself. I mean, this is complex, but not impossible to sort through. Mrs. Kowalski leaned forward. You have experience with medical advocacy? Sarah shook her head. I have experience with bureaucratic nightmares. Different type, same skill set. My grandmother used to say that half of getting proper care was knowing how to ask the right questions in the right order. She spread the papers across the coffee table, creating separate piles. Tell me about your symptoms, starting from the beginning. Not what the doctor said, but what you actually experienced. For the next hour, Mrs. Kowalski talked while Sarah took notes on her laptop. The story that emerged was frustrating but familiar. Chest pain that started mild and progressed. Fatigue that went beyond normal aging. Shortness of breath that made climbing stairs feel like running a marathon. 3 different cardiologists, each one ordering different tests, none of them seeming to coordinate with the others. Insurance companies that denied coverage for anything beyond the most basic diagnostics. Medications that seemed to help for a while, then stopped working, then got increased until the side effects became worse than the original symptoms. The thing that bothers me most, Mrs. Kowalski said, is that I know my body. I raised 4 children, worked as a nurse for 30 years before I retired, survived my husband's death and my own cancer scare. I'm not imagining things, and I'm not being dramatic. Something is wrong, and getting worse, and they keep treating me like I'm a confused old woman who doesn't understand her own medical history. Sarah looked up from her laptop. What did you specialize in when you were nursing? Mrs. Kowalski's smile was the first genuine one Sarah had seen from her. Cardiac unit. 25 years at Mercy General, back when nurses actually had time to sit with patients and notice things that didn't show up on charts. The irony wasn't lost on either of them. A former cardiac nurse couldn't get proper cardiac care because of her age and insurance limitations. Okay, Sarah said, closing the laptop and sitting back. Here's what I think we should do. And I'm going to say we, because you're clearly not going to get anywhere fighting this system alone, and I have some skills that might actually be useful here. Mrs. Kowalski raised an eyebrow. What kind of skills exactly? Sarah grinned. The kind that got me in trouble with my business partner but might work in our favor now. I'm very good at research, very persistent about getting answers, and I have absolutely no respect for people who think they can dismiss someone just because of their age or insurance status. They started with a complete audit of Mrs. Kowalski's medical records, which took most of the afternoon. Sarah created a timeline on her laptop, noting dates, symptoms, treatments, and outcomes. What emerged was a pattern that none of the individual doctors seemed to have noticed. The chest pain episodes were increasing in frequency and severity, but they weren't random. They correlated with specific activities, times of day, and even weather patterns. The medications that stopped working had all been changed. Around the same time, Mrs. Kowalski had started taking a new prescription for her arthritis. Have you mentioned the arthritis medication to your cardiologist? Sarah asked. Mrs. Kowalski frowned. Dr. Martinez prescribed that. Dr. Kim handles my heart. They don't talk to each other. Sarah made a note. Drug interactions. That's something we can research. She pulled up a medical database on her laptop and started cross-referencing Mrs. Kowalski's medications. Within 20 minutes, she'd found 3 potential interactions that could explain the worsening symptoms. This is exactly what I mean, Mrs. Kowalski said, reading over Sarah's shoulder. I told Dr. Kim about all my medications. He should have caught this. Sarah nodded, but she was thinking about something else. Her grandmother had faced the same issue. Specialists who treated individual organs without considering the whole person. Insurance systems that discouraged coordination between providers. Patients who were expected to be their own medical coordinators without the training or resources to do it effectively. We need leverage, Sarah said suddenly. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story. Mrs. Kowalski looked confused. Leverage how? Sarah was already reaching for her phone. My ex-business partner might have been a disaster to work with, but she's now a healthcare journalist. And she owes me a favor. The call went to voicemail, but Sarah left a detailed message explaining the situation. She specializes in systemic healthcare failures. If we can document your case properly, it might be exactly the kind of story she's looking for. Mrs. Kowalski was quiet for a long moment. You're talking about making this public. Sarah nodded. If necessary. But first, we try working within the system. We just do it smarter and with better documentation. She opened a new document on her laptop. We're going to create a comprehensive file that includes everything. Your complete medical history, a timeline of symptoms, documentation of every appointment and medication change, records of insurance denials, and evidence of potential medical errors or oversights. When you walk into your next appointment, you're going to be the most prepared patient they've ever seen. They worked until evening, organizing papers, making phone calls to insurance companies, and scheduling appointments. Sarah took detailed notes about everything, creating a system that would make it impossible for Mrs. Kowalski's concerns to be dismissed or overlooked. By the time they finished, the coffee table looked like a command center, and Mrs. Kowalski looked more energetic than she had since Sarah had known her. Why are you doing this? Mrs. Kowalski asked as Sarah gathered her laptop and notes. I mean, really? You barely know me, and this is a lot of work for someone else's problems. Sarah paused at the door. Because when my grandmother was dying, she spent her last 6 months fighting for proper pain management. The doctors kept saying she was exaggerating, that women her age tended to be dramatic about discomfort. She died in pain because they wouldn't listen to her. She met Mrs. Kowalski's eyes. And because I know what it's like to have people dismiss you when you're trying to explain that something is seriously wrong. The next morning, Sarah woke up to her phone buzzing with an unknown number. She almost ignored it, but something made her answer. Sarah Chen? The voice was unfamiliar, professional. This is Dr. Patricia Williams from Mercy General. I understand you've been helping one of our former nurses, Margaret Kowalski, with some medical advocacy. Sarah sat up straighter. Yes, though I'm not sure how you got my number. Dr. Williams laughed. Margaret gave it to me when she called this morning. She said you'd compiled some research about potential drug interactions that her current providers missed. I'm calling because Margaret was one of the best cardiac nurses I ever worked with, and if she says something is wrong, I believe her. Dr. Williams explained that she'd recently returned to Mercy General as the new head of cardiology after spending 5 years building a cardiac program at a research hospital in Boston. She'd heard about Mrs. Kowalski's case through the nursing staff, many of whom remembered her and were concerned about the care she was receiving. The thing about Margaret, Dr. Williams said, is that she probably knows more about cardiac symptoms than half the doctors treating her. She trained most of us when we were residents. If she says her medication isn't working, it's not working. Sarah felt something loosen in her chest. Are you saying you'll take her case? Dr. Williams was already ahead of her. I'm saying I want to see her this afternoon, and I want you to bring all that documentation you've compiled. From what I understand, you've done more comprehensive coordination in a week than her other providers have done in months. The appointment was scheduled for 2 o'clock. Sarah spent the morning refining her notes and creating a summary document that would give Dr. Williams everything she needed to understand the situation quickly. Mrs. Kowalski was waiting in the hallway when Sarah came to pick her up, dressed in her best cardigan and clutching a purse that probably hadn't been used in months. I haven't been this nervous about a doctor's appointment in years, she admitted as they walked to Sarah's car. What if she's just being polite? What if she takes one look at me and decides I'm just another complaining old woman? Sarah helped her into the passenger seat. Then we moved to Plan B. But I don't think that's going to happen. She sounded genuinely concerned about you. Mercy General was a maze of corridors and apartments, but Dr. Williams had arranged for them to meet in her office rather than an exam room. She was younger than Sarah had expected, probably mid-40s, with the kind of direct manner that suggested she didn't waste time on pleasantries. "Margaret," she said, standing when they entered, "you look exactly the same as you did when you were telling me how to properly read an EKG 15 years ago." Mrs. Kowalski's whole demeanor changed. "Patricia Williams, I should have known you'd end up running your own department. You were always too smart to stay a resident forever." The reunion was brief but warm. Then Dr. Williams turned her attention to Sarah's documentation. She read through everything methodically, asking questions and making notes. "This is impressive work," she said finally. "You've identified several issues that should have been caught months ago. The drug interactions alone could explain most of Margaret's symptoms." She looked at Mrs. Kowalski. "I want to admit you for observation and run a complete cardiac workup. Not because I think you're imagining things, but because I think you're right that something significant is being missed." Mrs. Kowalski's eyes filled with tears. "You mean you actually want to figure out what's wrong instead of just adjusting my medication and hoping for the best?" Dr. Williams nodded. "I mean, I want to treat you like the experienced healthcare professional you are instead of dismissing your concerns because of your age. You've been advocating for patients your whole career. Now it's time for someone to advocate for you." The admission process took most of the afternoon. Sarah stayed with Mrs. Kowalski through the paperwork, the initial tests, and the transfer to a cardiac monitoring unit that looked nothing like the sterile, impersonal rooms where she'd been treated before. The nurses recognized Mrs. Kowalski's name from hospital folklore, and word spread quickly that one of their legendary colleagues was back as a patient. Instead of being treated like an inconvenience, she was welcomed like returning family. "This feels surreal," Mrs. Kowalski said as Sarah prepared to leave for the evening. 6 hours ago, I was convinced I was going to die alone in my apartment with no one taking my symptoms seriously. Now I'm in the cardiac unit where I used to work, being treated by a doctor who actually listens." Sarah squeezed her hand. "This is just the beginning. Dr. Williams is going to figure out what's wrong, and then we're going to make sure it gets fixed properly." Dr. Williams called Sarah at home that evening with preliminary results. "We found the problem," she said without preamble. "Margaret has a small but significant blockage in one of her coronary arteries that wouldn't show up on a standard EKG but explains all her symptoms. The good news is it's treatable. The bad news is that if it had gone undiagnosed much longer, she could have had a massive heart attack." Sarah felt her knees go weak. How did 3 different cardiologists miss it? Dr. Williams was quiet for a moment. Because they weren't looking for it. They saw an elderly woman with vague cardiac complaints and assumed it was normal aging combined with anxiety. They ordered the minimum tests required by insurance and adjusted medications when those didn't show anything definitive. The conversation that followed was both enlightening and infuriating. Dr. Williams explained how systemic biases in healthcare often resulted in older women receiving substandard cardiac care. Their symptoms were more likely to be dismissed as anxiety or exaggeration. Insurance companies were more likely to deny advanced testing. Doctors were more likely to assume their complaints were psychosomatic rather than physiological. "Margaret's case is textbook," Dr. Williams said, "and unfortunately it's not unique. We see this pattern constantly." Sarah spent that night researching cardiac care disparities and was horrified by what she found. Study after study showed that women, particularly older women, were significantly more likely to be misdiagnosed or undertreated for heart conditions. The survival rates were lower not because the conditions were more severe, but because the care was delayed or inadequate. Mrs. Kowalski had been fighting not just her heart condition but an entire system designed to dismiss her concerns. The next morning brought a call from her ex-business partner Julia, who had finally gotten Sarah's voicemail. "Tell me more about this story," Julia said, "because what you described sounds like exactly the kind of systemic healthcare failure I've been investigating." Sarah explained Mrs. Kowalski's case in detail, emphasizing how close she'd come to a potentially fatal misdiagnosis. Julia was already taking notes. This is huge, Sarah. Do you realize you might have just saved this woman's life by doing basic advocacy work that her own doctor should have been doing? Julia wanted to interview both Sarah and Mrs. Kowalski for an article about healthcare advocacy and the importance of having someone navigate the medical system with you. The angle I'm seeing is how a simple act of neighbor kindness uncovered a systemic failure that could have been fatal, Julia said. But I also want to explore how patients can advocate for themselves and each other when the system fails them. Sarah was hesitant about the publicity, but she thought about Mrs. Kowalski's comment about Dr. Williams being the first doctor in months to actually listen to her concerns. Mrs. Kowalski was scheduled for a cardiac catheterization the following day, a procedure that would allow Dr. Williams to see the blockage clearly and determine the best treatment approach. Sarah arrived at the hospital early to find Mrs. Kowalski awake and alert, surrounded by former colleagues who had come to visit during their breaks. "It's like a reunion in here," Mrs. Kowalski said, grinning. "Half the nursing staff remembers when I trained them, and the other half has heard stories about the legendary Margaret Kowalski, who could spot a cardiac episode from across the unit." The procedure went smoothly, confirming Dr. Williams's diagnosis and revealing that Mrs. Kowalski was an excellent candidate for a minimally invasive treatment that would clear the blockage without major surgery. "She should be back to normal within a few weeks," Dr. Williams told Sarah afterward. "Full recovery, no lasting damage, completely treatable condition. If you hadn't pushed for proper advocacy, she probably would have had a heart attack within the next month or two." The words hit Sarah like a physical blow. A month or two. Mrs. Kowalski had been that close to dying because no one had taken her seriously enough to run the right tests. Julia's article was published 3 weeks later, just as Mrs. Kowalski was returning home from her successful treatment. The piece was titled, "The Neighbor Who Saved a Life by Checking More Than the Mail," and it detailed how Sarah's simple act of helping with correspondence had uncovered a potentially fatal medical misdiagnosis. The response was immediate and overwhelming. Sarah's phone started ringing with calls from people who had similar stories about elderly relatives or neighbors struggling to get proper medical care. Mrs. Kowalski had become something of a celebrity at Mercy General, where her case was being used as a teaching example in the residency program. Dr. Williams had asked her to speak to medical students about the importance of listening to patients and taking their concerns seriously, regardless of age or insurance status. "It's funny," Mrs. Kowalski told Sarah over coffee in her spotless apartment, which now felt warm and lived in again. "I spent 30 years advocating for patients, and I couldn't advocate for myself. It took a neighbor who barely knew me to see what I needed." The story could have ended there, with Mrs. Kowalski healthy and Sarah feeling good about helping someone in need. But Julia's article had sparked something larger. Sarah started getting emails from people asking for help, navigating medical bureaucracies for themselves or family members. At first, she tried to refer them to professional patient advocates, but she quickly learned that such services were expensive and not widely available. Most people were facing the same situation Mrs. Kowalski had been in, trying to navigate complex medical systems without the knowledge or resources to effectively advocate for themselves. Sarah found herself spending more and more time helping people organize medical records, research symptoms, prepare for appointments, and communicate with insurance companies. It wasn't work she'd sought out, but it was work she was apparently good at, and it felt more meaningful than any of the corporate consulting she'd been doing to pay rent. Mrs. Kowalski started helping too, using her medical background to review cases and offer insights about symptoms and treatments that family members might not understand. 6 months after their first conversation in the hallway, Sarah and Mrs. Kowalski had accidentally created an informal patient advocacy network that was helping dozens of people get better medical care. Julia had written a follow-up article about their work, and Dr. Williams had started referring patients who needed extra support navigating the healthcare system. What had begun as checking someone's mail had evolved into something neither of them had expected but both of them needed. "You know what I realized?" Mrs. Kowalski said one evening as they worked through a particularly complex case involving a woman whose insurance company was denying coverage for a procedure 3 different doctors had recommended. "When you first offered to help with my mail, I thought you were just being polite. I didn't understand that you were offering to actually see me as a person who mattered." She looked up from the papers spread across her kitchen table, which had become their unofficial office. That's what was missing from all those doctor appointments. They saw my age, my insurance, my chart, but they didn't see me. Sarah nodded. thinking about her own experience with being dismissed and overlooked after her business failed. "It's amazing how invisible you can feel when people stop taking you seriously," she said. "Like your voice doesn't count anymore because of circumstances beyond your control." Mrs. Kowalski smiled. "Well, we're certainly not invisible now. Did you see the email from that woman in Phoenix whose mother got proper cardiac care after using our documentation template? Or the one from the man in Baltimore whose father finally got his medication interactions reviewed? The network they'd built was entirely word of mouth, spread through Julia's articles and the recommendations of people they'd helped. Sarah had created templates and guides that people could use to organize their own medical advocacy, and Mrs. Kowalski had written a handbook about how to communicate effectively with healthcare providers. They weren't charging for their help, supported instead by Sarah's freelance income and Mrs. Kowalski's pension, but they were making a real difference in people's lives. Dr. Williams had become an unofficial advisor to their work, reviewing their medical guidance to ensure accuracy and connecting them with other healthcare providers who supported patient advocacy. "What you two have created," she told them during one of their regular meetings, "is filling a gap that shouldn't exist but absolutely does. Patients need advocates, and the healthcare system doesn't provide them. You're doing work that saves lives." Coming from someone with her credentials and experience, the validation meant everything. The apartment building where they both lived had transformed too. Other residents had learned about their advocacy work and started checking on each other more intentionally. Mr. Patterson from 2A brought his diabetes management questions to Mrs. Kowalski. The young mother in 3C asked Sarah to help her understand her son's ADHD treatment options. Mrs. Rodriguez from the ground floor started organizing monthly building meetings, where people could share resources and support each other with various challenges, medical and otherwise. "This is what community is supposed to look like," Sarah said one evening as she and Mrs. Kowalski watched Mr. Patterson help Mrs. Rodriguez carry groceries upstairs while discussing his latest blood sugar readings. "People actually knowing each other and caring about each other's well-being." Mrs. Kowalski nodded. "It's what I missed most after my husband died. Not just having someone to talk to, but having someone who noticed if I was struggling and cared enough to ask if I needed help." Julia's editor had approached Sarah about writing a book about their patient advocacy work, but Sarah wasn't sure she was ready for that level of exposure. She was still rebuilding her professional reputation after the business failure, and she worried about taking on more than she could handle. Mrs. Kowalski, meanwhile, had been invited to speak at nursing conferences about the importance of patient advocacy and the challenges faced by elderly patients in the current healthcare system. "I never expected to have a second career as a healthcare activist," Mrs. Kowalski said, reviewing her speaking notes for an upcoming conference. "But then again, I never expected my neighbor to save my life by noticing my mail was piling up." Sarah laughed. "I never expected my complete failure as a tech entrepreneur would give me skills that were useful for medical advocacy. Life is weird that way." They had both learned that sometimes the most important work you do is work you never planned to do, growing out of circumstances you never wanted to face. The first anniversary of their meeting approached as spring returned to the city. Mrs. Kowalski was healthier than she'd been in years, with her cardiac condition completely managed and her energy levels restored. Sarah had found a sense of purpose that her previous career had never provided, and she'd built a network of relationships that felt more meaningful than any professional success she'd achieved. Their informal advocacy service had helped more than 200 people navigate medical challenges, and they'd started training other volunteers to expand their reach. "Do you ever wonder what would have happened if you'd minded your own business that day?" Mrs. Kowalski asked as they sat in her apartment, surrounded by thank-you letters from people they'd helped. "If you'd just ignored my overflowing mailbox and gone on with your life?" Sarah considered the question seriously. "I think we both would have been fine eventually," she said. "You would have figured out how to get proper medical care, and I would have found some other way to rebuild my career. But we wouldn't have had this." She gestured around the room, which had become a hub of community activity and mutual support. Mrs. Kowalski smiled. "No, we wouldn't have had this, and a lot of other people wouldn't have gotten the help they needed either." She picked up one of the letters, from a woman whose elderly father had received life-saving cardiac treatment after using their advocacy resources. "I used to think my nursing career was the most important work I'd ever do. But this feels bigger somehow. More personal." Sarah understood exactly what she meant. There was something powerful about advocacy that grew out of genuine relationship and mutual care rather than professional obligation. The knock on Mrs. Kowalski's door that evening was soft and familiar. Sarah opened it to find Mr. Patterson holding a plate of homemade cookies and wearing an expression of nervous determination. "I wanted to thank you both," he said, stepping inside carefully, "and to ask if you might help me with something else. My daughter lives across the country, and she's been having trouble getting proper care for her pregnancy. The doctors keep dismissing her concerns, and I thought maybe—" His voice trailed off, but they both understood. Sarah and Mrs. Kowalski exchanged a look that contained an entire conversation. Another person who needed an advocate. Another system that was failing someone who deserved better care. Another opportunity to use their skills and experience to make a real difference in someone's life. "Of course," Sarah said, reaching for her laptop. "Let's start with what's been happening and what kind of help she needs." Mrs. Kowalski was already clearing space on the table for a new case file. As they settled in to hear Mr. Patterson's story, Sarah thought about the question Mrs. Kowalski had asked earlier. What would have happened if she'd minded her own business? She would have missed out on the most important relationship of her adult life. She would have missed out on work that felt truly meaningful. She would have missed out on being part of a community where people actually cared about each other's well-being. Most importantly, she would have missed out on learning that checking on someone's heart was just as important as checking their mail, and sometimes more so. The evening stretched ahead of them, filled with the familiar rhythm of organizing documents, making phone calls, and creating advocacy strategies for someone who needed their help. Outside, the city hummed with its usual energy, millions of people living parallel lives with minimal intersection. But inside Mrs. Kowalski's apartment, 3 neighbors sat around a kitchen table, proving that sometimes the most powerful thing you can do is simply pay attention to the people around you and care enough to act when you notice they're struggling. Mrs. Kowalski poured coffee while Sarah opened a new case file on her laptop. Mr. Patterson began explaining his daughter's situation, and they all leaned in to listen. Another story was beginning. Another person who needed someone to notice that their concerns mattered and their voice deserved to be heard. The work would continue, growing out of the simple recognition that everyone deserves to have someone check on their heart, not just their mail. Up next, you've got 2 more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.